What is gout? This is an arthritic condition that occurs primarily on the feet, although it certainly can manifest itself in other parts of the body. It affects about 3% of the population and is predominantly a male disorder, with only 5% of the cases affecting females, generally post-menopause. This condition is associated with hyperuricemia, which is an increased amount of uric acid crystals circulating through the blood. However, not all people with hyperuricemia experience gout attacks. Symptoms of gout. Gout is manifested by an acute onset of severe pain, redness, and swelling, many times for no apparent reason. Many patients will complain of a sudden onset of pain occurring early in the morning while asleep. The theory behind this is that when sleeping, the feet are elevated and there is a slight diminishment of blood to the feet, which in turn decreases the temperature of the feet just enough for the uric acid to crystallize in the joint of the foot and create pain. Other factors that may precipitate this attack include local trauma, foot surgery, an acute medical illness including diabetes, hypertension, kidney disease, hyperlipidemia, a high purine, protein diet, including organ meats, seafood, high fructose, sugar diet, an alcohol binge, medications such as diuretics, water pills, low-dose aspirin and cyclosporins, chemotherapy, high body mass index and metabolic syndrome, genetics. Diagnosis is generally on clinical appearance and the presenting history, because it is not uncommon for uric acid levels to be normal during an acute attack. In fact, the only way to confirm a diagnosis of gout is to actually test for uric acid crystals in the synovial fluid, joint fluid. Treatment of gout. Colchicine is the drug of choice in acute attacks and is almost diagnostic for gout if the pain is alleviated by the drug. This drug should not be used in individuals with kidney or liver disease, nor in those on dialysis. Anti-inflammatory class of drugs may also be used, but it is important to note that they all do not work for this problem. In fact, low doses of aspirin will actually worsen a gout attack. The two anti-inflammatories I use are indocin and naproxen. Steroids may be used in individuals who cannot tolerate oral anti-inflammatories. They can be administered both orally and injected into the joint. Gout pain generally lasts a few days, and then begins to diminish. The problem is when a person experiences multiple attacks over short periods of time. In those individuals experiencing repeated attacks of gout, it is necessary to find out why. Generally speaking, it is usually from either the body overproducing too much uric acid or the kidneys excreting too little uric acid. Allopurinol. In situations where a person is having attacks on a repeated basis, he or she should be on oral medication to control uric acid production, rather than medication to reduce the inflammation of an individual attack. This way destruction to the joints of the feet and ankle are minimized, and of course there is less overall pain. Uricose. When it is determined that the kidneys are under excreting uric acid, this class of medication helps improve the removal of uric acid from the kidneys. Diet modification. Patients who are prone to attacks should modify their diets in regards to a low purine diet and should abstain from organ meats such as sweetbread, liver, kidney, anchovies, sardines, rich gravy, and alcohol. Cherry juice. A simple treatment that has been mentioned in various sources is that of eating cherries, or drinking cherry juice on a regular basis. This may diminish the attacks. It is postulated that the anthocyanins in cherries reduces the amount of uric acid circulating in the blood. Read the complete article at www.foot-pain-explained.com/gout.html.